So we'll be talking about both prevention and early detection of cancer today. So what are we talking about when we talk about, what is cancer exactly? What are we talking about? What is the difference between a cancer cell and a normal cell? So a cancer cell is a cell which has a DNA damage, in simple words. So the DNA of the cell is damaged. Now, what can happen when there is a damage? The basic thing is, if say for example anything is damaged, it can suddenly malfunction and create a problem, havoc, or it can die. These are the two things which can happen in a cancer. Any damaged item. Same way in the body also, whenever there is a DNA damage to the cell, either the cell can die or repair itself. That's another possibility. Or there can be a havoc, which is now what is the cell damage will go to the cell. Suddenly that mechanism cell is gone. That mechanism the cell you may ask so what? Let it divide. It goes beyond the boundaries. For everything we have a boundary. That is, it is, anything within that bound of that bounds. That is the situation. Who muted me now? Okay. So if it goes beyond that particular boundary, that is when it starts becoming ugly. Now the problem with cancer cells is that they start getting out of that boundary in which they are supposed to be encompassed, and they start spreading across everywhere. So that is the problem, and that is why we are worried about cancer. Otherwise, it is not a problem. Let it divide, we'll keep quiet. No, it doesn't work out. These cells start multiplying and spreading across and going somewhere else and start destroying the rest of the organs. So that is why we are bothered about cancer. So it is growth for the sake of growth. And that is the ideology of cancer cell. It is simply growing because it just wants to grow. No purpose behind it. It is like our human growth also, where we have grown so much and we have destroyed the environment, created so much havoc around, and this is the typical scenario. So what human beings are doing to nature, the cancer does to our human body. It is the same scenario. So is another important question which I come across very commonly when I speak in various forums is cancer incidence increasing in the society? Is it increasing in India? We're seeing so many cancers. So why is it happening? So if you see the cancer incidence, if you see this graph, it is from 2004 to 2020. This is the projected figure which was there, but there was a constant increase in the number. Is it true? Yes, it is true. Our incidence of cancer, or the number, if you compare only the numbers, number of cancer patients have increased and are projected to increase further as well. It is not going to come down over time. There is a reason for it. If you see this is the chart which talks about or shows you what has happened to our survival. If you look at 1950s, if a person survived older than 35 or 37 years, that person was living very, very long. So the average recorded survival in our country was about 37 in 1950s. So that was the survival. And today, we have reached somewhere around 70 years of age, and we are expected to live longer. And that is because we have treatments which are available. There are many reasons for that also again. See, one of the major reasons why this has happened is this. The disease scenario has completely changed over the past years or so. Those days, it was infectious diseases which was killing people. There was gastroenteritis, there was tuberculosis, there was no antibiotic available, pneumonia used to kill people, typhoid used to kill people, malaria used to kill people. So there were, if you see the list of diseases in 1900 which were killing people, it was dominantly infection. Predominantly it was infection. But over time, things changed. So people started living longer. And what happens with when one side of the cause of death is removed, the other sides which are non-infectious start becoming more prominent, and these are heart diseases, cancers, diabetes, all these other factors start combining together, they start causing problems. So that is why we are seeing an increased incidence of cancer. So eventually what is happening is our population is aging. We are having people who are older than 40 regularly. Most of us end up living much longer, and because of that we are prone. So it is increase in non-infectious diseases overall that we are seeing, because that is why we call ourselves diabetic capital of the world, because we have huge population, we are seeing so many people. So this is a basic graph that will make you understand. See, up to 40 years of age, you don't get any genetic damage. You don't develop that kind of damages in the body. It is after 40 that you start seeing the effects of whatever you have done before 40. It is only after 40 that you start seeing it. So it is the accumulated damage which starts manifesting as you get older. So you start seeing heart diseases, you start seeing cancer, you start seeing strokes, you will start seeing Alzheimer's, you start seeing diabetes. Everything starts after the age, that bar of 40. So it is possible to develop diseases which are chronic. So age is an unavoidable risk factor for cancer. So that you have to keep in mind whenever you if anybody asks that question, because age itself is one unavoidable risk factor. Now, apart from age which is not avoidable, what are the things which we can prevent or take an effort to reduce? And this is what will be the core of the topic today. Now, what are the things which we can do? It is divided into two parts. One is reduction or reduce the risk of cancer, that is by primary prevention, and secondary prevention, wherein we try to detect cancer early, that is by self-awareness and by screening. So these are the two different aspects, two separate aspects which we have to cover today. So what is this risk reduction? If you see these two pictures, what is very predominant is the guy on this side without helmet is a person going for style, going for whatever. But if there is an accident, the person who's likely to survive the accident is the person who has taken all the preventive measures, this guy with the helmet. So this is what is the clear concept of reducing the risk. So the idea of reducing risk is when there is an exposure to something, you are basically trying to avoid, or you are reducing the chance that you may be exposed. So in real life, how do you do it? There are many things. So we need to understand what happens in what are the main causes of cancer in the society. If you see this will give you almost everything that is associated with cancer in this chart. So whenever we talk about cancer, people think genetics is the most important thing. But you see this chart, it contributes only to about 4% of the cancers. Means genetic means I'm talking about hereditary. I'm not talking about genetic damage. Genetic damage is the cause of cancer. But hereditary, is it a hereditary cancer? The answer is no. Only about 4 to 10% of cancers are truly hereditary. What else? What is important which comes up is the diet and the obesity or the overweight or all those factors which are dietary and exercise related. So how much do they contribute? They contribute about 15% for obesity, that is your body weight and the exercise related, and 6% of it is to what you eat. So that is one category. So, people think, oh, I eat this, I'll not get cancer. Is it true? No, it doesn't happen that way. The contribution is there, but it is a small percentage. So, in fact, your exercise can reduce your risk much better than what you eat. Remember that. And also, very important factor in your life is, personal hygiene. Because infections contribute to about 10% of cancers. So we'll talk about these things in more detail, but infections do contribute and you have to keep that in mind. And what is marked in red over here, the tobacco, pan masala are the major components of cancer. See, 40%, nearly 50% of cancers are caused just because of use of tobacco and tobacco related product. So in the flip side of it, other side of it is that, if you are able to restrict tobacco or eliminate tobacco, you eliminate nearly 50% of cancers. So after all that left is removed, what is left is about 25% of the cancers, and in this particular group of cancers, we don't know what is causing, what is the causative factor. So these are the main causes. We'll get into it a little more in detail. If you look at this, these are the 5 factors which we need to understand in little more detail. So I'll cover that in one slide each or two slides each. So first is tobacco. I told you nearly 70%. I told you about 50% of the overall cancers, but when you isolate only the lung and mouth cancer, nearly 70% of them are associated with tobacco. It is either smoked or smokeless tobacco, which is very common in India. Second-hand smoke also contributes to these cancers. But remember this, there is hardly any cancer that is not associated with tobacco use. Every cancer is some way or the other is associated. Now, this is the statistics. This is ICMR data. If you see this, the incidence of smoking in India among men is about 42%, among women is about 14%. So that is, nearly half of men use tobacco, and half of this they use chewable tobacco, other half smoke tobacco, and predominantly they use BD as an which is more popular in the rural areas and all that. So BD is one of the things which is used. And what is this second block which you are seeing is the impressionable age, a teenage, young, pre-young adults, they are teenagers. This is an impressionable age. This is when they start using tobacco, and this is an age group which we have to target in order to get a long-term result. If we are able to prevent these children from using tobacco, that has a long-term effect. And the last thing over here is the second-hand smoke. Second-hand smoke also is very important, and that contributes to some amount of cancers. So we have to, the tobacco rules in India which were put are, for this, but yes, it is not followed very strictly, and there are issues, something the administration has to take care. So choose a life without tobacco, rather choose life and not tobacco is the key thing in this. Now, alcohol is another important factor. 22% of cancers among men and 9% among women are due to alcohol. And amount of alcohol consumed has a link. Initially, when I started talking about alcohol, there were not much evidence which was available. But if you see today, we have evidence for many cancers, including breast cancer among women, has a role to be played, or role is played by alcohol consumption. There is a big research paper which was published from UK to prove this. So alcohol has a role. Infections leading to cancer, very important to understand. Infections which are viral infections, and there is one bacterial infection. Viral infections, of course, very popular. The human papilloma virus, which is important for cervical and penile cancer of penis. There are other viruses like hepatitis virus, which causes liver cancer, and HIV also has a role to play in cancers. So there is a specific cancer called Kaposi sarcoma, but there is an indirect link to the cervical cancer as well as penile cancer. So there are infections which can lead to cancer, which see, this is about 22% of cancer deaths in India are associated with some kind of infection. And what is the transmission of these viruses? Like, we are talking about HPV, we are talking about hepatitis virus. Predominantly, it is blood-borne, that is, tattooing, sexual contact, mother to newborn, sharing toothbrush for that matter. For some of the infections like HPV can work. So these are the main things. We have to be careful about all this. And all these infections, including cervical cancer, is caused because of a chronic injury. Means, repeated injury, because these infections stay in the liver. Liver, for example, for hepatitis B and C virus, if they stay in the liver for a long time, they keep on damaging, and the damage accumulates over the years and finally leads to fibrosis, and then it becomes cirrhosis, and cirrhosis means hardening of liver, and finally it leads to cancer. So this is a cycle, but cancer happens only in about 1 to 2% of the patients. It's not that everybody gets cancer. Same with cervical cancer. Cervical cancer is more well known among people. But the beauty of cervical cancer, you have to remember, is that about more than 90% of cervical cancers are caused by HPV, against which there is a vaccine today. Okay, so, and other good part of cervical cancer is that there is a huge gap between the infection to onset of cancer. It's about 10 to 15 years. So anybody who goes for screening within the 10 to 15 years and is diagnosed, can be saved with the simple procedures. So, but still we get so many patients who come to us in advanced cancer. So it is very, it is very, very annoying for a doctor also to see this, that a patient who can come early very easily with a simple screening technique, called pap smear or one of other techniques which are there, but ends up coming to us in very advanced stage. It is very unfortunate, and it's a very perfectly preventable and very simple procedures can cure if they come early. And vaccine, as I told you, there are 2 companies which are producing the vaccine, and they're commercially. Even if vaccine is taken, the person has to go for screening, because still the 10% of the patients have cervical cancer which is not related to HPV. So for their sake, the screening, that is pap smear test, has to be continued, but otherwise the risk comes down by 90% if any of these vaccines are taken. Now, other important factor which I told you, very common question, can computers cause cancer? People ask me, yesterday somebody asked me, the answer is, I said yes. It is not because computers will cause cancer, it is the chair, because you are sitting there, you are not exercising, that is why you will get cancer. So exercise, as I emphasized earlier, exercise is a very important thing when it comes to cancer. There are many cancers which are avoided just by keeping a healthy body weight and at least a 30-minute exercise per day. Of course, food is very important. Diet contributes. I told you about 6% of the cancers can be because of diet, but more importantly, it is the exercise which is important. So the mantra or the message is, look, this is Superman. The doctor is flying and start jogging. That is the mantra. You have to stop flying and start jogging, exercise that helps you. Yes, diet is something which I had also worked on. I published, and this was covered well previously. One of the major papers, one of the papers which has been quoted even by a Nobel laureate in this paper, von Zurhausen, who actually detected that HPV causes cervical cancer. So, a paper which related diet to colorectal cancer. So that's one of the publications. So coming to another last factor in this, the environmental pollution. It's something which we cannot really, measure very often. How much is the contribution? But anywhere between 1 to 4% of cancers is what they talk about. WHO says, and there are many contributing factors, and this is predominantly for lung cancer. And this is the data. It is not just cancer, it is also other diseases. In fact, more than, it says about 7% of cancers it contributes. But look at this, it is heart disease. So I think this I completed. The air pollution, contributes to about 7% of lung cancers. So apart from this, what is very important, or, you did all this, and patient comes in front of me and sits and says, "Doctor, I have done everything, but still, why did I get cancer?" There is a component called bad luck. You can slip on after all precautions, you may slip on a banana peel. You cannot help that. That is a rare possibility. But after doing everything also, there is a small risk that a person may get cancer. And this bad luck factor is also there. But, some cancers are age-related. Like thyroid cancer and all, person may get much earlier than, before age of 40. In fact, there are some cancers which occur before age of 40, but they are small numbers, but they do occur. Now, coming to the early detection, what is this I have seen showing you? There is an accident, and you might have heard this terminology called golden hour. So a person who gets medical attention in that period, which is called a golden hour, can save lives. So that is the of early detection, when there is a chance of better cure or better treatment. So the whole idea comes because, you have, if you see this particular graph, you'll understand it. Graphic, you'll understand it. It's a time. So if the cancer is detected, because of the symptom, it gets detected quite a little later, and the life expectancy can come will be little less, or comparatively less. There may be good number of patients who get cured as well. Early detection, because of various other mechanisms, the life expectancy may be better, and the best when the screening detects it. The screening or screening tests are predominantly meant for detecting cancer before the first symptoms appear. So what is being aware? So every one of us need to be aware of our body. The basic idea is that any bumps, lumps, any changes in your body, any blood coming out of anything, like for example urine, stool, anything, if there is a wound which is not healing, there is a patch in the mouth, there is some mole, black colored mole on the skin somewhere, there is persistent indigestion, there is persistent bloating of the stomach, there is hoarseness of voice which is new. So all these things, if they don't go away 2 to 3 weeks, then that needs a medical attention. That doesn't mean that it is cancer, but it needs medical attention, and cancer has to be ruled out in those cases. So that is the basic idea, that you should be aware that when to seek medical attention is very important. Now, also very important to remember is cancer is generally a painless disease to begin with. So very often I get patients coming, "Doctor, I had this lump, but it was not painful, so I did not come." The fact is, Cancer, when it starts, for example, breast cancer, 90% of them are painless lumps. So the pain is a late feature. So if you wait for pain, then you are very late. So you should go to medical help when it is painless lump, when it's a lump. So many other scenarios, the symptoms are different. In fact, I keep telling this in many forums, the symptom of cancer is the symptom of that particular organ. It is not related to cancer, it is related to that organ. So if it is stomach, you'll feel like gastritis. If it is rectal cancer, it will feel like piles because there is some bleeding or something like that. So there is no separate symptom related to cancer. It is related to the organ that it involves. Very important concept of cancer prevention is self-examination. It's very important, and especially in breast, every woman above the age of 21 should examine, or above any age group, forget 21, any age group should fix a date or use a date about a week from her menstrual periods, starting of the menstrual period or ending, whichever, it's a fixed date in that range, to feel their breast, to look for any changes. It is not everyday examination. Remember that if you examine every day, you will end up not noticing anything. If you see a person every day, you can't make out whether the person is gaining weight or losing weight. So it is very important that a woman examines her breast in a formats are there. These are available. So you can examine and find out if there is anything new that appears. Better to take medical help immediately. So many things are there in this, which any change is important. Any change has to be further evaluated. Same way, oral cavity, mouth. You can stand in front of the mirror and look at yourself. Every one of us can do that. Any ulcer, any patches, red or white or black patch, or any nodules, swellings which appear in the mouth, need to be investigated. There's no shame in going to a doctor and showing, what is this, that has to be evaluated further. It needs to be checked. See, this is a early change of a oral cancer. This is called leukoplegia. If the person waits, it can get very, very late. I'll start, this is really bad kind of scenario. I'll show you the next picture, but remember, 80% of world's oral cancers occur in India. Remember, so India is the world cancer capital. 70% are related to the tobacco usage. So prevention and early detection is possible just by examining the mouth, just looking inside. In fact, you see, specialized clinic like mine, we use specialized lights to check the oral cavity to see whether there are any specific areas which need further evaluation. But see, this kind of a patch requires further test. And if people end up like this, it's a perfectly preventable thing. But people end up coming to us like this very late. So other things, many others like testicular examination, self-examination is feasible. Any lumpiness, anything that appears new needs further evaluation. So apart from this, any changes in the body require evaluation for the sake of testing to make out if there is anything. So apart from this, it's very important to go for screening tests for anybody above, say, 45 years of age. An yearly health examination could detect some of the things early. So the idea of screening test is to diagnose before any major symptoms start. The idea is not that symptom has to come and then detect. Then it's not called early detection. It is not called screening. It is called early detection or a late normal detection. Now, the very fact, why are we doing it? Why do we screen? It is mainly because cancer can be cured if it is detected early. Now, which are the screening tests which are available commonly? It is breast cancer. Women, there are only for women, breast cancer mammography is available. For cervical cancer, Pap smear is available, which is to be done after the age of 21. For men, prostate cancer screening is advisable from the age of 50 by doing a blood test for PSA. For both men and women, colon cancer screening is possible, which can be done with fecal test of the feces or by colonoscopy. So these are the two things which are available and advocated above the age of 50. So these are the main cancers which people get. There are few other cancers which do not have specific tests, but a general test which includes examination of general physical examination, hemoglobin test, and all that can also detect cancer. So they are also very important. So why early detection? I told you the treatment is simpler, it is shorter, we can avoid deformities, we can avoid complications related to treatment, and a quick recovery from the treatment is possible. So so this I think I can skip. It's the relative proportion of which cancer and what is there in India. We'll skip that. I'll just give you one example here. See, for example, if a colon cancer or rectum cancer, if it is detected in stage 0 or stage 1, just a simple surgery would solve the problem. We don't need to do major mutilating surgeries. But if it is detected in stage 2 and 3, we require to do surgery, and also patient will require additional treatment like radiation and chemotherapy. And if it is stage 4, most of the stage 4 cancers we cannot cure, and the treatment becomes lifelong. Surgery may or may not be useful, and it becomes predominantly chemotherapy or some form of what is called as palliative therapy. We are not trying to cure it. Many of them may not be curable. This is a small segment where we attempt to cure, but most of them are not. So the idea is to detect in stage 0 or stage 1 or maximum stage 2 to get a result. So the treatment becomes less traumatic. And today, with the evolution of modern technology, many of the early diseases we can do robotically or laparoscopically. The things have changed, evolved. Today we are looking at less treatment or less aggressive treatment, which is becoming more popular, and it is sufficient in most of the cases. So the things have moved from this kind of a big wound to very tiny wounds, and many times we don't even see any scar in the patient. So robotic surgery has contributed to this kind of treatments, and this is, I just thought I'll share it with you. And another question which keeps popping up every time in every talk is hereditary cancer, because especially after Angelina Jolie underwent bilateral mastectomy, breast surgery, and also she underwent removal of the ovary, and see, the strategy for that is completely different. If there is a high number of cancers in the family, you need to consult and make a plan. It is not random tests. I have seen many patients doing random mammography, ultrasound, that. There are specific things which have to be done for specific cancers, and I would strongly advise you consult oncologist to plan that. So I won't go into these statistics. I think we spoke about it. Coping with, it's very important to remember, cancer is a curable disease in most of the situations.